Welcome to another episode of F I've Got a Brain Injury. My name's Ken, and I'm here with Jesse.
The idea of this podcast was to have a podcast for people with brain injuries, for people with family members who have brain injuries, for people who want to learn more about brain injuries. And I wanted to let it be known that me and Ken, the hosts, have brain injuries. So I apologize for my voice, and I also apologize for Ken's face. Thank God you can't see it. He has a face for radio.
I have a face that would make a freight train take a dirt road.
So sit back, relax, grab some popcorn, and enjoy. Hello and welcome to F It, I Got a Brain Injury. I'm here with Ken, and today we're here with a very special guest. My service coordinator, she's one of the top New York State social workers. So, show some respect, Ken.
How much is he paying you? That's all I want to know.
We'll talk about that later. So Wendy, you are my service coordinator.
I am. I'm Wendy Decker. Jesse, I think I've been your service coordinator for about 10 years now, which has been a fun ride.
Yeah.
And for how long was it good for? 3?
It's always fun. It's always fun. So I've been a service coordinator for the last 18 years at Living Resources. And I'm not a social worker, but I do have a BA in sociology. And I've been working in service coordination with people since 1991, before you were born almost. So I've worked with people with developmental disabilities, people with mental health challenges, and now with people with brain injury for the last 18 years.
Are you the most tenured there?
She's one of them,
I'm
right?
one of them. We have one other service coordinator there that's been there a couple years longer than I.
Wow.
Really?
Yes. And it is unusual to have service coordinators stick around this long.
Yep.
So we have people like Jesse that keep us happy.
Right. Or keep you guessing.
Keep me guessing.
So Wendy, you work at Living Resources, right? Living Resources, right?
Yes. I'll talk a little bit about Living Resources. We're a not-for-profit agency that started in 1974, operating one community residence for people with developmental disabilities. And today the agency employs over 850 people, and they offer services and programs to a wide diversity of people with both developmental disabilities, traumatic brain injury, and other disabilities. So they offer clinical services, residential services. They have college and employment services, after-school programs, community habilitation programs, and veterans services and family support services are just a few. In order to, the traumatic brain injury program of Living Resources, which is called the Acquired Brain Injury Program, we offer services that include care coordination, which is the service coordination. We offer life skills and have a fine arts department program, and we have clinical services.
Life skills. You mean like
That's
ILS?
ILSG. Yeah.
Yeah, that's a.
You did that for a
Ken,
while.
I did do ILST, but they kind of like don't exist anymore. I thought.
They're coming back.
Are they
Yep.
really?
Do you want me to go into the waiver?
That's what I'd like to start off with, how you get on
And
it.
then I can talk a little bit also about the services, because ILST is one of those services. And you're right, there are periods when there are scarcity of service providers, and there's a lot of reasons for that that I can talk about.
Okay.
But basically, there's a lot of different agencies that have to contract with the Department of Health in order to be a provider of TBI services. And some of those agencies are for profit and other agencies are not for profit. So Living Resources is just one of many that are contracted with the Department of Health.
I'm wondering, though, do you think that the for-profit agencies are better? Because Living Resources is a non-for-profit, right?
Well, that's a matter of opinion. They have a different focus. I think there's a different focus. I'm not going to really
I wouldn't, yep.
Okay.
make a judgment on that per se. I've always chosen to work for not-for-profit agencies, but that's a personal choice.
So, Wendy, what is the general difference, though, between for-profit and non-profit?
Well, to be a not-for-profit agency, you have to be established, I think, as a 401k and get established, and then it has to do with taxation as well as the monies are turned back into the overall agency, whereas for-profit agencies, they're for profit.
Right.
Uh-huh.
But do you think the for-profit agencies do a better job, maybe?
Not necessarily.
No.
No. Sometimes they're bigger, but
Okay. So, Wendy, we wanted to know, how do you get into the waiver? How do you become part
Okay.
of the waiver?
well, that's why I was going to explain a little bit about the structure of the waiver, okay? If you wanted to become involved in the TBI waiver, what I'm going to talk about is exclusive to New York State. There are different types of programs in other states, and I don't have knowledge of that.
Is
But-
there an age limit of any kind?
Yes, I'm going to talk about all that.
Okay.
So the provider agencies like Living Resources, they have to contract with the Department of Health. Well, the Department of Health has what's called regional resource developmental centers that are scattered throughout New York State that serve specific counties. In our area here, we're Capital Region, and the Capital Region Regional Resource Developmental Center, which we refer to as the RRDC, they're based at Sunnyview Hospital. We also serve the Adirondack region, and they're based in Queensbury, okay? The Capital Region covers Albany, Schenectady, Greene, Rensselaer, Schoharie, and Columbia County, whereas the Adirondack region covers Fulton, Montgomery, Saratoga, Washington, Warren, Hamilton, Essex, Franklin, and Clinton counties. So those are the counties that we serve through Living Resources, okay? And we work with these two regional resource developmental centers, one being Capital Region, the other being the Adirondack region. Okay, so if you were a person that had acquired a brain injury and you want to apply
Yes.
for the home and community-based waiver, the purpose of this waiver, by the way, which was developed in April of 1995, was to help people with brain injuries get out of nursing homes, okay, and to live in communities with services wrapped around them. So in order to qualify for a TBI waiver, you would need to go to the Regional Resource Developmental Center that I just referenced, and you can get this information on the New York State Department of Health website. Just Google TBI waiver, and you would need to apply at the Regional Resource Developmental Center to determine if you qualify. They would kind of walk you through the process, and they would help you locate a service coordinator.
Now, was
So-
that while they're still in the hospital?
It can be,
Okay.
okay, but you need to, that's why in order to become eligible, you have to have been diagnosed with a TBI.
Okay.
So you will have already had to have had some kind of medical documentation that indicates you've acquired a brain injury or a related condition. Sometimes people have strokes, and that leads to brain injury.
Know all about that.
Right? So you also need to be considered eligible for a nursing facility level of care, okay? And that's something that is actually done annually throughout the time you're even on the TBI waiver.
Yeah.
Jesse's familiar with that, so are you.
Yep.
That's called the UAS now, which stands for a Universal Assessment System. So if you were injured and you're still in the hospital, very frequently the folks in the hospital, the social workers there, can work with you and make sure the team conducts a UAS. So that level of care is determined at that time. But you need to be eligible for a nursing facility level of care to qualify for the waiver.
What would make you ineligible?
It has to do with the level of care that you need to take care of your needs in the home, okay? So if you didn't really need that much support and you were pretty independent, you may not qualify.
Right.
Okay. You also have to be enrolled in the Medicaid program in New York State. And Medicaid varies state to state. That's why I'm only going to reference New York State. To qualify for Medicaid, okay, because not everybody is already eligible for Medicaid when they have their brain injury or acquire their brain injury.
I know. Yep.
Okay, so you have to apply as an individual with a disability, and you have to present your medical documentation of that to Medicaid at your local county Department of Social Services. Your income is a factor, and that's the one piece that seems to catch people, okay? Luckily, since 2023, the income limits for Medicaid in New York State increased significantly.
How much is it now, if you don't mind me asking?
I have it written here.
It used to be 2,000, right?
No, it used to be approximately $862 a month was your maximum amount of money.
I think
Right.
I'm thinking
You
of
could-
the amount I'm allowed to have in my account.
Yeah, that's different.
I know I
Okay.
had to sell a lot of things before I could get on it.
Well, today, there's ways to deal with that too. Today, in 2024, the maximum income to qualify for Medicaid is up to $1,677 a month. It used to be $862.
Yep.
So there's been a big jump, and this has been since 2023. And it was a very positive move that enables a lot more people to qualify for Medicaid in New York State. So let's say that your income is $2,000 a month, and the maximum earnings you can make is $1,677. Well, you're you're $323 over the limit to
Right.
qualify for Medicaid. Well, you'll have a couple of options. One is you can make a spend down every month to Medicaid and give them that $323 and still qualify, which is significant given the level of services you would need to be paying
Right.
for waiver services, or you can establish a special needs supplemental trust.
Which we both have.
Okay.
Yep.
And we talked about it.
And some people have private trusts that they do with an attorney, or they have what's called a pooled trust that they can do with a not-for-profit organization. And the two in this area that we work with is often NYSARC or Center for Disability Rights. Okay? So what you would do with a trust, if you guys have already talked about this on your podcast, that's great. You would simply, instead of making that spend down to Medicaid, you would make that spend down into your trust, and then some of those monies would be available to you to pay some of your other bills.
Yep.
Okay? So I'm not going to go more into trusts. So your Medicaid eligibility needs to be established. You need to have a diagnosis and medical documentation of a TBI. You have to be eligible for nursing facility level of care. And then, Ken, you asked about age limits. You need to be between the ages of 18 and 64 years of age. And you had to have acquired your brain injury after the age of 18 to qualify for this specific
Right.
TBI waiver.
So what do they do with people that are 70? Is there a
Well,
program for them too? Or?
Yeah, that we have the nursing home diversion waiver that has more recently merged and is overseen by the same RRDCs throughout New York State that oversee the TBI waiver.
Is that like a good thing or a bad thing?
It's a very good
Yeah, it's
thing.
a good thing.
It is.
Because it enabled me to get my mom out of a nursing home when she was placed there after rehab. And I was able to wrap services around her. So I've been on both ends of the fence.
Mm-hmm.
You know, I've been a consumer of services through a waiver, as well as the service coordinator coordinating everything for you with a TBI waiver.
What was the average wait time to get on the waiver?
It really depends upon the availability of service coordinators. We have a large number of agencies that provide service coordination. That's where you work with your regional resource development specialist at the RRDC offices to find one. I really don't know, but I know there are wait lists. But they'll work with you to try to find someone. I was able to find someone for my mom pretty quick. But I know that we've had a wait list for a while.
When I first got on it, it wasn't that. It was probably like 13 years ago, and I think I only waited about 2 months. I'm sure it's much worse now.
Yeah, well, there's a scarcity of resources. There's not a lot of service coordinators out there. There's a lot of job openings in that area.
So, Wendy, how does someone become a service coordinator?
Well, to be a service coordinator and to be employed through the TBI waiver specific, you have to have a minimum of a bachelor's degree and 3 years experience in case management. Those are the requirements. And there's a wide diversity of people with different styles that make up service coordination, just like there's a wide diversity of therapists that provide counseling services. And like a therapist, it's important to find a service coordinator that's a good fit for you, because you want to find someone that you can talk openly with, not feel judged by, feel that your needs and wants are being respected, and that you can form a trusting relationship with. And that takes time, you know. A service coordinator is expected to meet with people every month, and service coordination is the one service under the TBI waiver that's mandatory. Other services under the TBI waiver are optional, okay? And I can go into those services if you'd like. But what the service coordinator is responsible for is evaluating the need for service. So if you went to the Regional Resource Developmental Center, you looked through the various agencies, you met with a few service coordinators, you picked one out that you felt was a good fit for you, then you work with that service coordinator to develop what's called an initial service plan. So they're going to sit down with you, they're going to talk about, you know, what are your strengths, you know, what are your needs, what services do you need to maximize your independence, whether that's living in an apartment on your own post-injury, or whether that's living with parents or a family member or a roommate. What services do you need to live in the least restrictive setting and maximize your independence? So we'll put together a service plan of outlining what your choices are. So you might want community integration counseling, which is CIC. Or you might want independent living skill training. You might have behavioral responses that are barriers to you functioning effectively in the community because of your TBI.
Are you talking about Jesse again?
No, Jesse never needed. But that's positive behavior intervention services. So we have PBIS, we call that. PBIS. And then the most frequent used service, I would say, is home and community support services. And that's where people have aides come in and they help with various activities of daily living or personal care. Yeah. So some people come into the waiver and they need almost 24/7 care around the clock to care for their needs. And under the TBI waiver, you cannot get full 24/7 care anymore because a significant other or family member is expected to be a part of that team. And
What if they don't have any family
well,
members?
and there are people that don't, and
So what happens
that's
there?
really unfortunate. With my mom, we had almost 24/7 care, and my sister and I provided some coverage. Um,
So how much will they cover now if it's not 24/7?
it depends. Basically, a service coordinator would have to justify the need,
Okay.
and then we have to justify the need for every single service in the plan and tie it to what your goals are. And then we submit these service plans to the Regional Resource Developmental Center, where their specialists evaluate and determine whether it meets all the qualifications of the program. And then they either accept that plan or they deny it. And if they deny it, you can always appeal. And there's a whole appeal process you can go through. But that said, it varies. It really varies because you need to be able to justify the need.
Right.
And I couldn't speak to what they will or will not approve. I just know that it needs to be justified. So you need a service coordinator that can write well and articulate what your needs are.
And do you have a choice between the aid services you can go with?
Absolutely. With every service under the TBI waiver, there's a large number of providers of service, unless it's an area where they don't have any staff,
Right.
like ILST that Jesse was referencing. But say HCSS, we have a huge list of providers, and a service coordinator will sit down with you and go through that list, and then you pick, who you want to meet with. We'll set up a meet and greet, very often with more than one provider, so you have choice. And that's what's critical, is your freedom of choice under this TBI waiver at all times to determine not only what providers you work with, but whether you want the service or not. No one can coerce you, and being on this waiver is voluntary. We do have rights and responsibilities form that is reviewed with participants, and we clearly outline under the waiver what the responsibilities of the participant is, so that if you secure services with an agency and with a provider and you want them, it's expected that you're going to follow through. And if you need to cancel services, have the respect to give notice and that kind of thing. At the same time, a provider also has a lot of responsibilities to you, to be there, to be on time, to be respectful, and it's always the role of the service coordinator
I'm
to
sure.
be the referee and to resolve any conflicts that may arise, because life happens.
Now,
Conflicts happen.
when you think of a conflict, we go to Living St. Rose, and our service coordination is through Living Resources. So how is that changing now that it's two different things, isn't it? Kind of. I don't know how to explain it.
Well, if we can jump ahead to that, that's fine. The conflict of interest is actually a federal ruling that came from the Center for Medicare and Medicaid Services way back in 2014. Okay? All states were required to separate case management, which is service coordination, from the service delivery functions of other services to reduce conflict of interest. And in New York State, this was delayed because we had a very strong alliance of providers and participants with TBI and family members and agencies like the Brain Injury Association of New York State, which is an advocacy organization that I strongly encourage anyone with a TBI to be involved with, because that's who you're going to work toward policy changes
Right.
that are handed down by government entities and impact your lives. Okay, so the alliance had slowed down the implementation of this federal ruling so that they could really be cautious in how that was going to affect people's life and the delivery of service.
The reason I asked this question, if you don't mind me asking, is might start doing a program at Living Resources again, the men's program.
Yes.
And what does Vinny have to do for me? Is it an addendum, or what do they got to do now?
No, what happens is, as of March of 2024, the New York State Health Department had to comply with the rule, okay? So what that really means is you cannot receive service coordination and other waiver services from the same provider.
Okay.
So, and yes, we're in the same boat, huh,
Yep.
Jess? I know Jesse's over here hemming and hawing, and I'm dismayed by it as well.
Yep.
What this means for people is that you need to make a choice, so that if Living Resources provides the structured day program services that you want, or independent living skill training services that you want, you cannot also continue with the service coordination from the same agency. So you need to make a decision to either pursue structured day program services from a different agency.
Which is a big issue for me.
Right.
Because now that St. Rose is closing,
Exactly.
there are other places we can go, which is Living Resources.
But there's other agencies.
Right.
Key to Independent Growth, Millview.
Yeah.
We do have other providers of structured day programs. However,
But
I want to acknowledge, Jesse, your concern, because it's very valid. Every structured day program is different, and not every program fits
Right.
every individual or their needs. So even what you experienced at St. Rose in their structured day program is radically different than the programs operating at Living Resources or the programs operating at Millview. That's why, as a service coordinator, when someone says to me, well, I want to check out some structured day programs, what I'll do is I'll encourage people to visit 3 or 4 different places, and then they're going to feel it out and see what environment best meets their needs. Are they focused on socialization? Are they focused on skill development and communication, which was happening here at St. Rose? And then you're going to pick what fits. The conflict of interest does put you in a position when there are fewer resources available, right, where you don't have a lot of choice.
In layman's terms, what is the conflict of interest? Again,
well, that's what I was gonna.
that's what I don't understand.
Well, but that's what I was actually talking about, was that now that St. Rose is closing, I'm gonna be going for. I may want to look into other programs at Living Resources, and since that Wendy is my service coordinator, I either have to choose between getting rid of her or receiving services through
Yes.
Living Resources.
And it has to do with, when they say conflict of interest, they're saying it's a service coordinator is supposed to be an autonomous, independent entity. And fiscally, all the monies that are associated with reimbursement for service coordination should not be conflicted with the delivery of other types of services.
So does that mean they want to give everybody a piece of the pie type of thing? That's what I don't get.
No. It means that there is if you come to Living Resources and as a service coordinator, I automatically start referring you to every program that Living Resources provides and not offering you the option to go to other agencies. That's a conflict of interest.
Right.
I'm padding the pockets of Living Resources under that circumstance. So that's a conflict of interest.
What do you get out of that?
No,
Do you
we
get
have a
anything from that?
responsibility for making sure that we pretty much just answer to you, okay? And even from a fiscal perspective, that no one is gaining anything.
That's what I
you
was
know,
right.
The fiscal piece. But your case management person is supposed to be independent and autonomous and advocating for you. If we're working for an agency that also provides you with a slew of other services, there could be a conflict of interest. If you come into conflict, say, with a home and community support program or a structured day program, and there's a lot of conflict, it's more difficult for a service coordinator to advocate for you if we're both working through the same agency, right?
Yep.
So that could be a conflict of interest. So I can't go into the whole history of how that ruling developed way back in 2014. I just know that in the end, it means that your service coordination, your case management has to be from an agency that does not provide you with other services, okay, under the TBI waiver specific, okay? That's how it's a conflict of interest. So where we stand today is, yes, people are being forced to make some tough decisions, and with the closure of St. Rose, it makes it even harder on people. That said, what we would need to do is help you find another. Let's say that you decide you're going to go and try Living Resources Structured Day, and you say, okay, I really want to continue with that program. I need that in my life for stability, and then it's going to be more important for you to continue that, and then your service coordinator works with you to meet with some other service coordinators from different agencies that you may select until you find a good fit, and then we do a change of service coordination.
Because one of the things I'm going to be doing, I'm going to start going back to Sunnyview, and that's not a conflict of interest for some reason.
Right. You can make a decision to go to different structured day programs outside of Living Resources if your service coordinator is with Living Resources.
Right.
'Cause this is affecting everybody.
Now I get it. Okay.
Okay. So there's people in other agencies like Key to Independent Growth or Millview. I mean, all agencies are facing this, not just us. All providers under the TBI waiver have to be in compliance, and it's a federal rule that trickled down to the state level, and now New York State has to implement it.
But it's such a small population of the TBI community that it's really pointless, no?
The federal government mandated this for the provision of all home and community-based services.
Thank you for listening to Ep10, I Have a Brain Injury. I'm Jesse, and this is Ken.
And I hope you all get something out of this podcast.
We would love to hear your stories too. See you next time.
See you next time.